This slide says Rural Health Transformation Program, preparing for the RFGP.
All right, let's get started. We will share our screens and begin the webinar. Thank you to everyone for joining this afternoon's webinar about the Rural Health Transformation Program, and more specifically, the forthcoming Catalyst Awards request for grant proposal process. We're really excited to share updates to that grant proposal process and give you all an overview of where we are in terms of the status of the program. Okay, let's get the slides pulled up.
This slide details that the webinar is being recorded and how to access live captioning. Do you see the slides, Judy? You might need to change your view.
Okay. Let's see. There we go. I see the slides on my end. Thank you so much. So first things first, for this Teams webinar, if you would like live captioning, please use the button that says More, which has the ellipses symbol to select and show live captions. We also have ASL interpreters on. And due to the high number of registrants, we will not be asking questions live during the webinar. Instead, we will address those questions that were submitted in advance. And at the end of this presentation, we will post a link to a form for a question submission. Next slide.
This slide has a disclaimer. This webinar presentation is supported by the Centers for Medicare and Medicaid Services of the U.S. Department of Health and Human Services as part of a financial assistance award totaling $197,271,577.67, with 100% funded by CMS HHS. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by the CMS, HHS, or the U.S. government.
All right. And this is just a disclaimer about our cooperative agreement and federal funding with the Centers for Medicare and Medicaid Services. Next slide.
This is the RHTP agenda, welcome and housekeeping, RHT program refresher, Catalyst Awards overview, and new information, steps to prepare for the RFGP, CMS allowable use of funds, next communications, and questions and answers.
Today, I am joined by my two colleagues, Suzanne Cross and Susan Almancy. We will be switching off during the agenda as we cover a brief program overview and status update. We'll walk through the Catalyst Awards scope and request for grant proposal process. Furthermore, we'll review in depth and provide scenarios for eligible types of projects and use of funds, and then conclude with reminders about communication and use the remainder of that time for questions and answers submitted by attendees. Next slide.
This is a title slide stating RHT program refresher.
Next slide.
This background slide goes into background on the Rural Health Transformation Program. H.R. 1, the Trump administration's federal budget reconciliation bill, was signed into law on July 4, 2025, introducing an estimated $15 billion in cuts to federal funding from Oregon for health insurance coverage, food benefits, and other programs. Federal funding through RHTP is not intended to offset H.R. 1 Medicaid cuts. H.R. 1 establishes a one-time, 5-year rural health transformation program, which makes funding available to states for health-related activities supporting rural communities and rural health system transformation. The Centers for Medicare and Medicaid Services is charged with administering the program as a cooperative agreement?
So this information here probably is very familiar to a lot of you, but I'd like us to work off of the same common understanding and know the origins of the Rural Health Transformation Program and the funding. So this was established back in July of 2025 as part of the federal reconciliation bill passed by the administration. This bill, HR 1, introduced an estimated $15 billion in cuts to federal funding across programs including health insurance, food benefits, and others. And federal funding for the Rural Health Transformation Program is not intended to offset HR 1 Medicaid cuts. However, this reconciliation bill did establish a 5-year program, RHTP, which makes funding available to states for health-related activities that are meant to support rural communities and their healthcare systems towards a more sustainable transformation. And the federal agency, the Centers for Medicare and Medicaid Services, is charged with administering this program as a cooperative agreement. And cooperative agreement is underscored here because states should expect more involvement, including detailed reporting and technical assistance from CMS than is typical of other grant programs. Next slide.
CMS announced $50 billion in awards to all 50 states. On December 29, 2025, CMS announced all 50 states will receive awards. In 2026, first-year awards averaged $200 million, ranging from $147 to $281 million. Oregon is receiving $197.3 million in 2026. OHA submitted a revised budget on January 30th, 2026. CMS approved the revised budget on February 18th, 2026. CMS unrestricted all funds on March 20th, 2026. If approved for a similar amount in subsequent years, Oregon will receive an estimated $1 billion over the 5-year grant period.
On December 29th of last year, CMS announced that all 50 states will be receiving an award for the first budget year. So there are 5 budget years to this program, which lasts 5 years. In 2026, the first year awards averaged $200 million, ranging from $147 to $281. Oregon landed squarely in the middle by receiving $197.3 million for the first budget period. OHA submitted a revised budget on January 30th, and CMS approved that revised budget on February 18th. And the newest update that we're excited to share here is that CMS unrestricted all funds associated with that budget on March 20th, 2026, so last Friday. The team has been working tirelessly on 2 major tracks during this period. One, which is designing the forthcoming RFGP and standing up this program, its operations, policies, an entirely new architecture, if you will. And then simultaneously, we have been in cycles of communication with CMS to unrestrict as much of our budget as possible. So initially, before March 20th, we only had access to state staffing funds. The remainder of the award intended for subrecipients and grant awardees was frozen. And over the past month, we've been working closely with CMS to provide newly available details about the budget, including additional information about the RFGP and the anticipated number of awardees. And so CMS, after receiving those additional details, deemed this information was sufficient to lift the restrictions on the remainder of the funds. And we were informed of this change just last Friday, which is exciting as we've cleared up some of the uncertainty, yet there's a lot of work that lies ahead. Each subrecipient will still be required to submit a detailed line item budget to CMS. And over the course of the next 5 years, if Oregon is approved for similar amounts of funding, the state will receive an estimated $1 billion. Next slide. Okay.
This slide reviews Oregon's Phase 1 from fiscal year 2026 to fiscal year 2027. Initial phase will focus on 3 pathways for implementation. Catalyst awards. Through a request for grant proposal process, organizations will be expected to apply across initiatives for ready-to-go projects that can be implemented within the first 2 years of the RHT program. 2. Immediate impact. Direct awards, non-competitive, for a select set of aligned opportunities identified by the state, not through an application process. Strategic investments will be made to independent rural hospitals, critical access hospitals, and rural health clinics to stabilize essential services and build readiness for Phase 2. 3. Tribal initiative. Direct awards, non-competitive, to the 9 federally recognized tribes of Oregon under the RHTP Tribal Set-Aside. 4. Regional planning and innovation. Partner with the Office of Rural Health to facilitate regional convenience and technical assistance to eligible entities as they form or further develop their regional partnerships, shared infrastructure plans, and build capacity to apply for Phase 2 funding.
So these are the three major pathways that RHTP dollars are getting out the door. Starting with the Catalyst Awards, which represents the bulk of the funding. We will award entities through a request for grant proposal process. Eligible entities will be asked to propose projects that align with one of Oregon's 4 initiatives. This is separate of our 5th initiative, which is a tribal initiative. These projects must be ready to launch and meet additional requirements designed to ensure federal compliance and strong administrative performance. Immediately after this background overview section, we'll walk through the full scope and expectations for this RFGP. Secondly, there is the Immediate Impact Awards. These awards are reserved for a select set of projects that can deliver significant and near-term benefits across the state. And these projects are unique in their ability to help us achieve our year 1 targets, which is necessary to ensure subsequent year funding. There will be no application process for immediate impact awards, and information about selected projects and organizations will be shared in April alongside the RFGP announcement. And then finally, the third distribution pathway is the Regional Planning and Innovation pathway. In partnership with the Oregon Office of Rural Health, funding under this pathway will focus on providing technical assistance on specific issue areas to spur dialogue and planning around regional care delivery solutions and to convene partners who would like to prepare collectively for Phase 2 of the program. Next slide.
This slide goes over 2026 Phase 1 Year 1 considerations. Goals: support ready-to-launch projects for timely impact and funding, stabilize critical services, and meet Year 1 targets through direct awards, support regional convenience to propel planning and innovation. Receive any RHTP award or technical assistance does not prevent you from applying for other RHTP awards, including Phase 2 Transformation Awards.
Here lies the goals of Phase 1 and Year 1. We intend and endeavor to support ready-to-launch projects for timely impact and funding, stabilize critical services, and meet Year 1 targets through direct awards, and finally, support regional convenings to propel planning and innovation. So those 3 bullets map to what I had just discussed were the 3 different pathways. Each goal is complemented by each other. And if you all provided information and feedback in last year's intent to apply survey or didn't, that participation has no bearing on your eligibility to participate in the forthcoming RFGP. So receiving any RHTP award or technical assistance does not prevent you from applying for other awards, including ones we have planned for Phase 2. Next slide, and I will pass it
This slide says Catalyst Awards Request for Grant Proposal Overview.
off to Suzanne.
Hi there, good afternoon. I'm Suzanne Cross. I use she, her, AI pronouns, and I'm a senior policy design and development analyst within the Office of Health Policy. I'll be providing some information on the Catalyst Awards, which, as Judy said, are an important part and the bulk of the funding in this initial phase of the Rural Health Transformation Program. The Catalyst Awards is a competitive grant process through an RFGP designed to select projects that are ready to be implemented to help both stabilize and transform the healthcare system within rural and remote Oregon communities. So if you've been following along in our past webinars, we'll hope you learn something new today that will help you prepare and think about the proposals that you're planning. Keep in mind there are many legal and technical parts of this award that we're really working diligently, as Judy mentioned, to translate with care and precision. And once the RFGP, the request for grant proposals, goes live, as we continue to learn more from the Center for Medicare and Medicaid Services, CMS, additional information sessions will be held with plenty of opportunities to ask questions and for OHA to provide responses. Next slide, please.
This slide goes over Catalyst Awards Request for Grant Proposals. Goal: to elevate and support community-driven, ready-to-go projects for timely impact and to effectively utilize available funding. Approach: limited number of grant awards will be available, 80 awards max. Award up to 30 projects between $200,000 and $499,000. Timeline: opens early April. Proposal submission period 45 days. Closes early summer. Awards announced mid-2026. Note, all dates are tentative pending CMS budget and OHA procurement finalization process.
So the intent of the Catalyst Awards is to support ready-to-go projects that align with the RHT program goals and are able to effectively utilize the funding within the allowable use of funds. A limited number of grant awards will be available. Specifically, up to 80 awards will be granted in this phase. We'll explain the difference between proposal and project in the next few slides, but I really want to point out here that there will be a limited number of awarded projects for between the amounts of $200,000 and $499,000. That minimum amount listed on this slide is specific to projects, not the overall proposal, and that'll become a little more clear in the next few slides. Also, the application period is expected to open in early April and to last approximately 45 days. As I stated earlier, additional detail on application requirements and evaluation criteria will be included once the RFGP is released. We also just want to note here that the dates are tentative and subject to CMS approval and our own state's procurement processes. So we'll continue to share updates as they're finalized. Next slide, please.
This slide goes over proposer information. Proposal limitations: one proposal per lead organization. Same organization may be named as a subawardee in other proposals. A proposal may include up to 3 projects. Each project must select one primary outcome and at least one associated target. Minimum project amount per budget period is $200,000. Maximum proposal amount per budget period is $5 million. Proposer requirement: organizations must have a physical location or provide in-person services/opportunities in Oregon. Be an eligible entity as outlined in the RFGP. Proposal submission: all proposers must submit an RFGP to be considered for funding, regardless of involvement in past intent to apply or other public surveys. Collaborative proposals are welcomed, but one eligible entity needs to be the lead proposer/fiduciary.
So this slide outlines some of the key parameters for submitting a proposal. Organizations can submit one proposal as the lead entity or proposer. To answer a question by one of our registrants ahead of this webinar, organizations may also participate as a partner or a sub-awardee in proposals submitted by other organizations. One proposal as like a package, may include up to 3 projects. Each project must be associated with one primary outcome and at least one of the associated targets underneath 4 of our initiatives. And the 4 initiatives included in this opportunity are the regional partnerships and system transformation, healthy communities and prevention, workforce capacity and resilience, and technology and data modernization. As a reminder, we also have the tribal initiative. That's a distinct component of RHTP and is being developed and implemented through a separate process. But the tribes are invited to apply for additional funds under this and other proposed initiatives. You'll see also on this slide, there's a minimum and a maximum. There are minimum and maximum funding thresholds, and these are per budget period. So it's important to think about how your project scope aligns within these parameters. The minimum project per budget period is $200,000. The minimum project amount per budget period is $200,000. And the maximum proposal, so the overall proposal amount per budget period, is $500 million. Next, we have on this slide the proposer requirements. So organizations who are proposing proposals must have either a physical location or provide in-person services or opportunities in Oregon. So again, note more details will be included in the RFGP. Also note that the proposal requirements required in this defined connection to Oregon overall, whilst the eligibility for a specific project is on the next slide. So this is about the proposer and the organization, and then there's specific eligibility for the projects, which will be on the next slide. And lastly, Yudi mentioned this, but regardless of involvement in our previous slide surveys or intent to apply survey, this is an open opportunity to all proposers, and all proposers must submit a fully completed RFGP to be considered for funding. And lastly, collaborative proposals are welcome, but each proposal must have only one entity as the lead. Next slide, please.
This slide goes over project eligibility. Projects must serve rural Oregon outside of a 10-mile radius of a 40,000 plus population center, align activities with at least one RHTP outcome, address at least one population of focus, maternal and child health, individuals with co-occurring behavioral health conditions, individuals aging in place, individuals with chronic disease. Be ready to implement within 1 to 2 months of award, ensure all activities fall within CMS allowable uses of funds, and participate in reporting and monitoring as required.
Okay, so at the project level, again, remember there's a proposal, and then a proposal may include up to between 1 and 3 projects. So at the project level, there are a few key requirements to keep in mind. Projects must serve rural Oregon as defined on this slide. So they must serve rural and remote Oregon. They must align with at least one RHTP outcome and address at least one of the populations of focus listed here on this slide. They should also be ready for implementation within a relatively short time frame following the award. And importantly, all the activities associated with a project must fall within CMS's allowable use of funds and comply with all the reporting requirements. Again, more specifics will be included in the RFGP, including allowable use of funds and any restrictions as it pertains to the Catalyst Award opportunity. As with any funding opportunity, there will be reporting and monitoring requirements, and we will do our absolute best to communicate those along with the RFGP, and there'll be additional clarification as we continue to learn more from our CMS partners. Next slide, please.
This slide goes over proposal versus project. What's the difference? Proposal, your full application submission. The complete package you submit for funding may include one or multiple projects, represents your organization's overall request and plan. Think of it as your portfolio. Project, a specific work plan within your proposal, one clearly defined body of work connected to an outcome, has its own goals, activities, timeline, and budget. Multiple projects can live within one proposal. Think of it as one piece of the portfolio.
Okay, so let's hone in a bit on the distinction again between proposals and projects. We want to make sure that this is really clear. A proposal is your full application, the complete project that you submit. So you can think of your proposal as the overall structure, and your projects are the individual components within it. Within each proposal, you can include, as I mentioned, one or more projects with a maximum of 3 projects per proposal. Then each project will need to have a specific set of activities with their own goals, timeline, and budget. And again, it will be tied to an initiative, one primary outcome, and at least one of the targets within the outcome. We also received a question from a registrant asking, can projects include multiple initiatives or outcomes? So yes, a proposal can include multiple projects, but each project may align with different initiatives, and you'll see an example of that here in a second. However, each individual project should clearly identify one primary outcome, as I mentioned, although it may also address additional outcomes that may be noted and subsequently reported on. Next slide, please.
This slide shows an example proposal structure. It states one proposal includes up to 3 projects. An example project is Project 1, workforce training at $1 million. Project 2, telehealth expansion at $300,000. Project 3, regional partnership at $500,000, for a total example of $1.8 million.
So here's the example that is meant to help visualize how the structure might look. A single proposal may include multiple projects, each with their own focus, but all combined into one solid submission from a lead entity. This can be helpful when you're thinking about how to organize your work or your partnerships. In this case, each project represents work under a unique initiative, and the overall proposal meets the requirements of being less than that $5 million that I mentioned on slide 11. Although this example includes a project in 3 of the unique initiatives, it doesn't necessarily need to be the case. An organization may have 2 or 3 projects that fall under the same initiative, but essentially under different outcomes. And so you can see this represents projects under workforce, under telehealth expansion, and under regional partnerships for different amounts per project. Next slide, please.
This slide goes over eligible organization types. Organization types eligible to submit proposals include, but is not limited to, rural health clinics, federally qualified health clinics, hospitals and hospital systems, behavioral health clinics, dental clinics, emergency medical services organizations, academic and workforce partners like universities, community colleges, education service districts, and school districts, public sector and federally recognized tribes, like local public health authorities, local governments, and federally recognized tribes. Additionally, it could be a community nonprofit and system partner, like social service and community-based organizations, professional associations, nonprofit advocacy organizations, coalitions, and coordinated care organizations.
This slide and the next one speak to the types of entities that are eligible to apply. This goes along with the proposer requirements listed previously on slide 12. We want to note that this list are the eligible organizations, but this is not an exhaustive list. There are a variety of organizations eligible to apply, including health care providers, academic entities, public entities, and community-based organizations. And again, not an exhaustive list. And on the next slide,
this slide goes over ineligible organization types. The following organization types are not eligible to submit proposals, but may be included as partners or subrecipients with eligible organizations: consultants or consultant organizations, health insurance carriers other than CCOs, and technology vendors.
you'll see this slide lists the organization types that are not eligible to apply as lead proposers. However, they may be they may participate as partners or as sub-awardees in a proposal submitted by another eligible organization. So if you're not eligible to apply, there still may be opportunities to be involved in a proposal. And I want to read out the definition of a technology vendor for this RFGP is an entity that designs, develops, and/or markets software applications and/or hardware. For example, EHR, electronic health record developer, EHR vendor, quality reporting software developer, quality reporting software vendor, etc. Had some examples. Okay, next slide, please.
The current slide goes over RHTP spending timeline for Catalyst Award RFGP. Pre-launch was in 2025. Budget period 1 goes from December 31st, 2025 to October 30th of 2026. The spending period for budget period 1 is December 31st, 2025 to September 30th of 2027, the end of fiscal year 2027. Budget period 2 starts October 31st, 2026 and goes until October 30th, 2027. The spending period for budget period 2 is October 31st, 2026 to September 30th, 2028, the end of fiscal year 2028.
Okay, so here we have a visual of the budget and spending period specific to the Catalyst RFGP. The funding will be distributed across the defined budget periods, as you can see on this slide. Proposers may apply for funding for budget period 1 or budget periods 1 and 2. The total amount per budget period is $80 million that will be available, and this is subject to CMS approval for budget period 2. Funds can't be carried over from one budget period to another. Awardees and any subcontractors or subgrantees will have through that following fiscal year to spend funds awarded for each associated budget period. So you can see below the budget period is an associated spending period, and that's the time in which proposers have to spend down the funds. No new activities for the second year can be proposed once the budget period ends. However, awardees can still access those initial funds in the federal fiscal year following the budget period to pay for activities approved for that associated budget period. So let me read a sample scenario, and hopefully this will encourage participants or applicants to think about how the timeline and their project aligns within these budget funding periods. So a proposer is awarded funding for the budget period of December 31st, 2025 to October 30th, 2026. They will have that time to implement an initiative that will take 18 months to complete, which includes any contracted services. In this scenario, the proposer would have access to the funding period after budget period 1, so after it ends, which is 10/30/2026, to pay the contractor for services until at least the end of the next fiscal funding year, which is September 30th, 2027. That means if the contractor did work from January to June 2027, and that work was approved as an approved activity for budget period 1, the proposer could pay for those costs that incurred in January through June 2027 from that budget period 1 funds. We realize it's complicated. We're totally open to lots of questions, and we'll have plenty of opportunities to ask questions and answer more, but hopefully this diagram explains the difference for you and helps you plan your proposals. Okay, that's the end of the slides specific to the Catalyst Award. We're going to go up, I think Susan's going to prepare
The following title slide says, "Preparing now."
us for the RFGP opening. Next.
Thank you, Suzanne. I'm Susan Almanzi. I'm the Communications and Engagement Lead for the Rural Health Transformation Program. And now we're going to shift gears a little bit and talk about the next steps that you can take now to prepare for the RFGP opening. Next slide, please.
The current slide denotes what you can do to prepare right now. To prepare for the RFGP, plan to submit your proposal using a hybrid process using Oregon Buys and Smartsheet. We will walk through submission steps in detail in upcoming webinars, but for now, register or confirm your account in Oregon Buys, register on sam.gov to get your unique entity identifier, or confirm you have your number, review eligibility requirements, understand allowable use of funds to shape project ideas. Next, you want to begin identifying your project leads, your fiscal staff, your partners, and you want to start gathering organizational documentation like a W-9, an FEIN, and contact info. Next, sign up for RHTP newsletter updates.
So there are a few key steps organizations can take now to prepare. This includes confirming your Oregon Buys registration, obtaining or verifying your UEI through sam.gov, reviewing eligibility requirements, and identifying internal staff or partners who would support this work and this proposal. Smartsheet is where you'll submit your project information, but you will still need to be registered in Oregon Buys as the official bidder to meet state procurement requirements. You can review the RFGP without being registered in Oregon Buys, but registering allows you to receive notifications about updates and any changes throughout the process. And just to clarify, registration at sam.gov is not required to apply, but it will be required if you are selected for an award. Next slide, please.
The current slide is an Oregon Buys overview. Oregon Buys is the state of Oregon's procurement system. You will use it to access the Catalyst Awards RFGP, receive emails about any updates or changes to the RFGP. You cannot be awarded a Catalyst Award without an Oregon Buys account. To the right, there's a picture of what Oregon Buys looks like.
Okay, so this is our Oregon Buys overview. Oregon Buys will be used to access the RFGP and receive updates and complete required procurement-related steps, as we mentioned in the last slide. While you can view the RFGP and begin preparing your materials without an account, an Oregon Buys account is required to complete certain steps needed to be considered for an award. Setting up an account in advance also allows you to receive automatic updates and notifications. Next slide, please.
The current slide goes over step 1, how to create an Oregon Buys account. First, go to oregonbuys.gov, select supplier login, and create account. Next, you want to enter your legal business name. It must match your W-9. Next, you'll want your FEIN or your TIN. You'll want your mailing address, your primary contact, and you'll want to assign an account administrator. Finally, you want to complete the email verification step and log in to confirm your supplier profile is active. Tip: have your W-9, tax ID, and legal name ready.
So if you do not already have an Oregon Buys account, we recommend creating one as soon as possible. You could start with step 1 here and follow these steps. But ultimately, you want to make sure that the information you enter aligns with your official business documentation, such as your W-9. Next slide, please.
This slide goes over step 2, add users and recommended roles. Recommended roles include account administrator, they manage your account and submissions, a bidder, a finance contact, which is optional, and best practice is to assign at least 2 people to prevent delays if someone is unavailable.
Step 2 would be to add users and recommended roles. So organizations are encouraged to assign appropriate user roles within Oregon Buys and include multiple users to support continuity as well as prevent delays during the application process. Next slide, please.
This slide goes into step 3, prepare your Oregon Buys profile. Ensure legal business information is accurate. Confirm email addresses are active. Oregon Buys sends all notices electronically. Add a secondary contact, bookmark your Oregon Buys dashboard, and ensure your firewall does not block system-generated emails.
So prepare your Oregon Buys profile. Take time to make sure your profile is complete and accurate, including contact information. This will help ensure you receive important notifications and updates along the application process. Next slide.
This slide details Step 4, locating the RFGP once released. You'll search for the solicitation by keyword, Rural Health Transformation, or Catalyst Awards, or you can use the solicitation number, which will be provided in early April. You can also browse public solicitations. There is an image at the bottom of this slide showing where the search bar is and where the supplier registration is.
So where to find the RFGP once it's released? The RFGP can be located in Oregon Buys using keywords or the solicitation number, which will be provided once the RFGP opens. Next slide.
The current slide goes over who to contact for help on Oregon Buys. For support registering, navigating the system, or submitting your RFGP proposal, email support. Supplier support is support.oregonbuys@das.oregon.gov. Oregon Buys system support is epro-support@periscopeholdings.com. Phone support is at the number 855-800-5046. It's a direct line for anyone needing help with Oregon Buys or proposal submission. Response times. After you submit a ticket, you'll receive an initial automated response within about an hour. A support agent will review your requests and provide a detailed reply within 1 business day in most cases.
We put together a list of who to contact for help should you experience any technical issues. Support is available through the contacts listed on this slide, and we encourage you to seek assistance early if needed. And the next slide. Now I will give it back to Yudi to explain the CMS allowable use of funds.
Thanks, Susan. If we can go to the next slide.
The current slide says CMS allowable use of funds. The current slide goes over CMS allowable use of funds. To be eligible, a project must fall within one or more of CMS's statutory uses of funds found on page 11 linked here for the categories. The categories include prevention and chronic disease, provider payments, consumer tech solutions, training and technical assistance, workforce, IT advances, appropriate care availability, behavioral health, innovative care, invest in rural health care facility infrastructure, and foster and strengthen strategic partnerships between local and regional partners.
So in terms of CMS allowable use of funds, recipients may only use funds awarded under this opportunity for the permissible uses specified in statute. So that's the HR 1 statute and described here. There are 11 use of funds categories. And these categories, as you might notice, are not mutually exclusive and have natural areas of overlap. Projects and proposers should identify the use of funds category that most accurately describes the work. And I will just list off the 11 use of funds categories, starting with prevention and chronic disease. That's promoting evidence-based, measurable interventions to improve prevention and chronic disease management. Second is provider payments. This is providing payments to healthcare providers for the provision of healthcare items or services. And this is subject to some limitations, including it cannot exceed more than 15% of total awards. Consumer tech solutions, that's promoting consumer-facing technology-driven solutions for the prevention and management of chronic diseases. Fourth is providing training and technical assistance for the development and adoption of technology-enabled solutions that improve care delivery in rural hospitals. Examples include remote patient monitoring, robotics, artificial intelligence, and other advanced technologies. So that's a pretty wide and broad category. Workforce is the fifth. That's recruiting and retaining clinical workforce talent to rural areas. And for certain types of recruitment and retention incentives and financial payments associated with this use of funds, there will be a commitment to serve rural communities for a minimum of 5 years. 6 is IT advances, providing technical assistance, software and hardware for significant information technology advances designed to improve efficiency, to enhance cybersecurity capabilities, and in the long term, improve patient health outcomes. And let's see, the next one here is appropriate care availability. And CMS defines this as assisting rural communities to right-size their healthcare delivery systems by identifying much needed preventative, ambulatory, pre-hospital, emergency, outpatient care service lines, and improving upon all of those. Behavioral health is also a use of funds category, and this is supporting access to opioid use disorder treatment services and other substance use disorder treatment services, and more broadly, mental health services. Innovative care. This category encompasses projects that support innovative models of care to improve health outcomes, better coordinate care, and promote flexible care arrangements. So new payment and delivery mechanisms such as value-based care arrangements and alternative payment models would fall under this category. Capital infrastructure and capital expenditure and infrastructure. So this means investing in existing healthcare facility buildings and infrastructure, including minor building alterations. Construction is not considered allowable under this use of funds category. And then finally, as the 11th category, fostering collaboration and strengthening strategic partnerships. This is really focused on initiating, fostering, and strengthening local and regional partnerships and collaboration between rural facilities and other healthcare providers. And if folks want to review more in depth each of these categories, they're listed in CMS's Notice of Funding Opportunity that's linked on this slide, and it starts on page 11. We will also be capturing this information in the RHTP documents. Next slide.
The current slide goes over Scenario 1, Diabetes Management Program led by Patient Navigators. Outcome is Outcome 3, Healthy Communities Initiative. Increase patient engagement with new preventative health and/or self-management programs. The population of focus is individuals with chronic disease. The project description is as follows. An FQHC wants to implement a patient navigator program focused on patient outreach, self-management education, and care coordination. These patient navigators would be trained CHWs who conduct either home visits or monthly telehealth check-ins, coordinate and deliver as appropriate nutrition education, support the primary care provider and care team in monitoring glucose trends, and connect patients to support services. Allowable RHTP expenses, non-exhaustive list. Developing and printing self-management education materials, hiring patient navigators to render non-billable services, purchasing and implementing telehealth platform, purchasing glucose monitors, and travel costs for home visits.
Okay, we will walk through a scenario of a potential project that would fall under Oregon's initiatives, specifically with this one, Scenario 1, Diabetes Management Program led by Patient Navigators. This type of project would address Outcome 3 under our Healthy Communities and prevention initiative. Outcome 3 is increased patient engagement with new preventative health and/or self-management programs. In our RHTP application, each of the initiatives had to list metrics and outcomes, at minimum 4 of them, for each initiative. And so if you're curious and want to learn more about those outcomes and their associated targets and metrics, please refer to the project narrative on our webpage. And I believe those outcomes start on page 51. Now, with this scenario, the population of focus is individuals with chronic disease, and the project description is as such. And FQHC, a federally qualified health center, wants to implement a patient navigator program that is focused on patient outreach, self-management education, and care coordination. These patient navigators would be trained community health workers, CHWs, who conduct either home visits or monthly telehealth check-ins. They also would coordinate and deliver nutrition education, supports the primary care provider and care team in monitoring glucose trends, and connecting patients to support services as needed. How would this project be allowable, and what type of expenses would be allowable? The list provided at the bottom of the slide, that's not exhaustive, but allowable expenses include developing and printing self-management education materials, hiring the patient navigators to render non-billable services, purchasing and implementing a telehealth platform, purchasing those glucose monitors, and also travel costs for home visits. Again, this is non-exhaustive, but hopefully paints a picture of the full sweep of what could be captured as an RHTP expense under this type of project scenario. We will provide ongoing support through additional information sessions during the RFGP window and updated written materials to help entities draft budgets and project scopes that are aligned with CMS's allowable use of funds. Something else I will note is that CMS has reserved the authority to determine eligibility on several types of costs on a case-by-case basis. So as a result, we are doing our best as a state, as an agency, to translate those requirements that are explicit in the Notice of Funding Opportunity, and also to interpret to the best of our abilities everything else that is not noted explicitly.
Scenario 2, Consumer Technology Solutions and IT Upgrades. Outcome 1, Technology and Data Modernization. Increase health IT adoption and interoperability. Population of focus, individuals aging in place. Project description, a rural clinic network plans to expand digital tools that help older adults safely remain in their homes while maintaining regular connection with care teams. The project includes remote monitoring devices, user-friendly communication platforms, and upgrades to clinical IT systems that support proactive outreach and early identification of health concerns. Allowable RHTP expenses non-exhaustive. Tablets, check-in kiosks, or remote monitoring devices not reimbursable by insurance. Telehealth platform upgrades to support routine virtual check-ins for older adults. Cybersecurity improvements such as multi-factor authentication and data encryption. Enhancements or new modules for existing EHR, EMR platforms. Patient accessible Wi-Fi access points inside facilities, not broadband infrastructure. Hotspots for patient use, subject to CMS case-by-case approval.
This is another example scenario related to consumer technology solutions and IT upgrades. This would help us address outcome 1 in our technology and data modernization initiative by increasing health IT adoption and interoperability. The population of focus is individuals aging in place, and the project scope is a rural clinic network plans to expand digital tools that help older adults safely remain in their homes while maintaining regular connection with care teams. So this project includes remote patient monitoring devices, user-friendly communication platforms, and upgrades to the network's clinical IT systems that would allow for more streamlined and proactive outreach and early identification of health concerns. Again, not an exhaustive list, but allowable RHTP expenses under this type of project would include tablets, check-in kiosks, and remote patient monitoring devices. It would also include telehealth platform upgrades to support these virtual check-ins, cybersecurity improvements, and assistance with health IT systems compliance and implementation, enhancements or new modules for existing electronic health record platforms. And then finally, the last example here, hotspots for patient use. That is an example where CMS has reserved the authority to review on a case-by-case basis and approval. Next slide.
This slide goes over unallowable use of funds. Funding cannot be used for pre-award costs, lobbying, supplanting existing funding, services reimbursable by other payers, and large-scale EMR replacement, greater than 5% of total funds.
There are also explicitly non-allowable use of funds, and please refer to the notice of funding opportunity if you would like to learn more about other limitations. We will also make that very clear in our RHTP. But some to highlight here: funds cannot be used for pre-award costs, lobbying, supplanting existing funding, supplanting Medicaid funding cuts, services reimbursable by other payers, and then large-scale EMR replacements have a cap of 5% of total funds. Next slide.
Scenario 1, hospital wing expansion. Unallowable category, construction or major renovations. Description: a rural hospital proposes using grant funds to build a new inpatient wing, add surgical suites, and upgrade the HVAC and electrical systems to support expanded capacity. Why it's unallowable. Program funds cannot pay for construction, structural expansions, or major facility renovations, including architectural design, permits, materials, or construction labor.
Now we're going to walk through some scenarios where it may be tricky to discern whether or not the type of budget item is allowable. One common example has been around the capital infrastructure category. So what isn't allowable with capital infrastructure investments is major construction or renovation. So a hospital may propose using grant funds to build a new inpatient wing, add surgical suites, and upgrade their HVAC and electrical systems to support expanded capacity and accessibility. What isn't allowable under this instance is funds to pay for new construction or major structural expansions and renovation. However, in contrast, what is allowable is retrofitting underutilized spaces within an existing facility. One could use funds to upgrade light fixtures and replace vents and thermostats for better climate control, and then also installing automatic door openers to enhance accessibility. So overall, the takeaway here is that CMS has made it very clear that anything with the term construction is strictly prohibited. In general, minor modifications to an existing building footprint, existing infrastructure, and existing rooms within a facility can be considered minor building alterations and thereby eligible. Next slide.
Scenario 2, replacing an existing program budget. Unallowable category, supplanting existing funding. Description: a county clinic has a long-standing care coordination program paid for by local funds. When that budget tightens, the clinic applies to use grant dollars to keep the existing program operating with no change in scope. Why it's unallowable. Funds cannot replace existing funding sources for ongoing operations, staff positions, or services that are already financed by other budgets.
Here's a more clear-cut scenario or circumstance where funds cannot be used to replace an existing program budget. So a county clinic, has a long-standing care coordination program paid for by local funds. When the budget tightens, the clinic applies to use grant dollars to keep the existing program operating with no change in scope. So this would be considered as supplanting existing funding. And moreover, the purpose of the Rural Health Transformation Program and its funding should go towards expanding existing services and programs into new rural areas or completely implementing new types of activities and programs. Next slide.
Scenario 3, paying for routine billable services. Unallowable category. Services reimbursable by other payers. Description. A health center requests grant funds to cover routine primary care visits, behavioral health therapy sessions, and vaccination services normally billable to Medicaid, Medicare, or commercial insurance. Why it's unallowable. Grant funds cannot pay for clinical services that are reimbursable by existing payers. The program is intended for transformation, not to cover routine billable care.
All right, this is the third scenario here. That would be unallowable, and that's paying for routine billable services. I think this one has been shared in the past as strictly not allowable. A health center requests funds to cover routine primary care visits, behavioral health sessions, and vaccination services that are normally billable to Medicaid, Medicare, or other payers. So again, grant funds cannot pay for services that are currently reimbursed by federal or state programs. This program, the RHTP, is intended to transform and not to cover routine billable care. Next slide.
The current slide displays the Oregon Health Authority logo and the word communication.
I'll pass it back to you, Susan.
Thanks, Yudi. Okay, so communication. We want to make sure you know how to stay connected and receive updates throughout this process. So the next couple of slides will direct you on how to get a hold of us and get a hold of updates. Next slide, please.
The current slide, titled Newsletter, displays two QR codes on the left-hand side, and it says visit our homepage with the URL linked underneath and sign up for our bi-monthly newsletter with the URL also linked underneath.
So updates will be shared through the RHTP website and newsletter. You can visit our RHTP webpage and sign up for our bi-monthly newsletter at the links and QR codes listed in the slide. Because all public-facing materials require CMS approval, updates may not always be immediate. Next slide, please. Additional
The current slide goes over next communications. Details on the Catalyst Awards RFGP will be shared via homepage updates, newsletter announcement, and a dedicated webinar. Next webinar date. To be decided, target early April 2026. Purpose, walk through RFGP detail. RFGP webinar series planned for spring 2026 to support interested proposers. Look out for upcoming communication on the homepage and in the newsletter for webinar and office hour schedules.
details about the RFGP will be shared through upcoming communications, including a dedicated webinar focused on application requirements. Participants are encouraged to monitor the website and newsletter for updates. Next slide, please.
The following slide shows the Oregon Health Authority logo at the top of the slide, and it says Q&A.
So we'll now move into the Q&A portion. And as a reminder, we'll be focusing on questions related to the application process and the available guidance to us. If we're not able to address your question today, we'll capture it and follow up through FAQs or future communications. And Yudi and I are going to pull up some questions that we have received in advance of the webinar and provide answers to them. So, sorry, one second. Okay. So, as a technology provider, is there a way for us to make our capabilities known to the RHTP stakeholders?
Yeah, and I believe we linked this in the Teams chat earlier. Vendors interested in partnering with local entities for the upcoming RFGP, they are invited to complete the vendor interest form. So that's linked in both this chat and on our webpage. This form will be used to develop a publicly accessible directory of vendors who are open to collaboration on the Catalyst Awards project. And then local organizations and lead proposers, they can look to this directory to identify potential partners as they prepare their proposal. I will also like to add to this conversation here that the Office of Rural Health is expanding their annual Rural Health Conference in October to include dedicated time for the Rural Health Transformation Program, those convenings that we had been talking about, and discussions. So this will include also hosting a vendor fair that would allow healthcare providers and vendors to have face time to support implementation of Catalyst Award projects, and also hopefully inspire collaboration and planning for phase 2 of this larger program.
Thank you, Yudi. Okay, this is more of a statement than it is a question, but it is a really good statement. So there are several different but similar terms used in your presentation slides, including regional partnerships and system transformation, regional planning and innovation, regional convenings and collaboratives, and regional sustainability.
Yeah, okay. Thank you for pointing out those differing terms, which fall into 2 nomenclatures or categories, if you will. So regional partnerships and systems transformation is one of the 5 official and approved initiatives in our RHTP program. Think of this as an area of activities and focus. In contrast, regional planning and innovation is the updated turn of phrase we're using to describe one of the 3 ways in which the state is distributing funds. The other 2, if you recall, are Media Impact Awards and Catalyst Awards. Regional planning and innovation is formerly known as regional sustainability. We had described it as regional sustainability in our application, but renamed it because we felt it was more appropriate in describing the types of activities that would happen under this distribution pathway. And regional convenings and collaboration are the types of activities we would expect to happen under that particular distribution pathway.
Perfect. Thank you so much. And last question that I have for you today is, can you apply for funding for different programs within your organization?
Yeah, and I believe this was captured quite succinctly by our colleague Suzanne earlier, but doesn't hurt to reiterate the difference between proposals and projects. So for the request for grant proposal that's coming out in April, we will allow for 1 proposal per lead organization. That same organization may also be named as a subawardee or partner in other proposals. A proposal is the package of 1 to 3 projects. So again, that proposal may include up to 3 projects, and each project must select 1 primary outcome and at least 1 associated target. As I mentioned and touched on before, we have at least 4 types of outcomes or 4 different outcomes per initiative that was submitted in our application. So there's an outcome, a way to measure for that outcome, and then yearly targets that we laid out. I believe that's page 50 or 51 in our application, which is linked on our webpage. So each project must select one primary outcome and at least one associated target. So under a proposal, it could be that there are 3 projects addressing 3 different primary outcomes, and thereby may touch on different initiatives. The minimum project amount per budget period is $200,000, and the maximum proposal amount per budget period is $5 million. And I think that wraps up the Q&A. Looking at the time here, we have some next steps on the next slide.
The current slide displays support resources, how to register as a supplier, step-by-step instructions to creating an Oregon by supplier account with the URL linked below. Supplier FAQ, answers to common questions about registration, navigation, and system use with the URL linked below. Supplier resources, additional tools, training materials, and support for Oregon by suppliers with the link below.
And here are the support resources. We have a step-by-step instruction manual for creating an Oregon by supplier account linked, as well as supplier FAQ and supplier resources. We will be sharing out the slides on our webpage, as well as a recording to this presentation. And please sign up for our newsletter. As Susan mentioned before, we will be getting information out through our newsletter as well. Okay.
The current slide shows pictures of medical professionals, the Oregon Health Authority logo beneath it, the words thank you, website, and our link to the website, email, and our email, rhtp@oha.oregon.gov. Thank you.